The United Nations Relief and Works Agency, UNRWA, has also been assessing the damage inside Jenin camp. It posted this tweet a few hours ago. It noted the destruction in the camp, including extensive damage to UN installations, including a health centre. Kate O'Rourke is a Deputy Director for Field Operations in the West Bank at the UN's Relief and Works Agency. She's in West Jerusalem tonight and joins us live from there. Good to have you with us. So I understand you also have been out visiting the camp. What conclusions did you reach?
Thanks very much, Sammy. We were indeed in Jenin refugee camp earlier today with other UN agencies and international diplomats from more than 25 countries. What we can see, as indeed your earlier reports have indicated, is significant damage to infrastructure in the camp, as well as a very large number of homes that have been damaged and destroyed. We also see that the people, the Palestine refugees in Jenin camp, are experiencing a humanitarian emergency, and there is intense suffering and psychological distress and significant needs that we as UNRWA, along with the rest of the community, need to respond to quickly.
Let me put to you the perspective of Israeli officials who argue that they need to launch what they call these military operations to target what they term as terrorist cells.
I think it's important as a worker with UNRWA, which is mandated to protect and to provide for the needs of Palestine refugees, that we focus our attention immediately on the response, given that there are still significant infrastructure damage that needs to be repaired, including more than 8 kilometres of water supply. The networks that have been entirely destroyed mean that people can't get water into their homes. Plus, similarly, more than 3 kilometres of sanitation networks. And our initial estimates that we've undertaken already indicate that there could be more than 900 homes that are damaged. 400 of those have already been assessed, and 57 of these have been destroyed or have been damaged so significantly that they're uninhabitable. So our focus for UNRWA is on restoring the essential services that we provide for Palestine refugees in the camp. We normally would have more than 100 staff on the ground in Jenin providing health, education, social and other services. And now we've brought in staff from elsewhere all over the West Bank, and are also looking towards other partners and community efforts and local authorities' efforts to be able to restore those services as quickly as we possibly can.
We've heard criticism.
As you mentioned, our health centre. Go ahead,
Yeah,
Sammy.
I was going to say, we've heard criticism from UN officials, from the Secretary General, talking about disruption of aid groups being able to operate, of first responders, of ambulances. Talk to us a little bit about that, about how difficult it is to do your job when this kind of military operation is launched.
Sure. During the period of conflict, we, along with other humanitarian actors, were not able to access Jenin refugee camp. And the residents who were there, the Palestine refugees who were in the camp, were not able to safely access the essential needs that they had. This included, in some cases, medical care. And we know that the Palestinian Red Crescent Society, which has been at the forefront of providing emergency care, as well as the hospitals in Jenin city, have managed to deal with many, many people who have come, who've been wounded and who've been injured. But we also know there have been reports of PRCS ambulances delayed and prevented from taking patients to care. While the conflict was still ongoing, we were able to successfully bring in medical supplies to the hospital, which is closest to Jenin refugee camp, just outside of the camp's borders. And that ensured that that hospital was able to continue to provide services for people who were evacuated. In addition, we continued to advocate for safe access so that people living in the camp could continue to access food, water, hygiene materials, and other things that are essential for everyday life. But while the operation was ongoing, we were unable to maintain that. As soon as on Wednesday morning, as soon as the operation was complete and the conflict had ceased, We were then very quickly able to resume responding. And I want to say that in addition to UNRWA and other UN agencies, NGOs, local community and local authorities have also been leading this response. We've provided during that time emergency shelter and assistance for more than 3,500 people who were displaced from the camp to Jenin City. And then from early Wednesday morning, we immediately undertook efforts to provide water because the water supply had been cut off for several days, as well as food, medicine, and started to assess the damage and the needs.
All right, thank you so much for sharing your experience. Kate O'Rourke there.
Thanks very much.